Hello everyone, hope you are all doing good. In this video, we are going to discuss about menstruation. Menstruation is nothing but the cyclical discharge of blood and mucus from the inner lining of the uterus, that is the endometrium, through the vagina, from puberty till menopause, except during pregnancy. Clear? So, that is discharge of blood as well as mucus tissue every month in a female, right? And this starts just from the puberty and it lasts up to menopause, and it is not seen physiologically during pregnancy. So, pregnancy is a state of physiological amenorrhea, right? Now, when we take menstrual cycle, it is divided into two cycles again. So, the sequence of changes that is happening in the ovaries as well as in the endometrium. So, one that is happening in the ovary is called ovarian cycle, and that is happening in the endometrium is called endometrial cycle. So, ovarian cycle is further divided into three types, namely follicular phase, phase of ovulation, and then the luteal phase. Whereas endometrial cycle is divided into menstruation, proliferative phase, and you have secretory phase as well. Clear? So, we are going to divide and study the menstrual cycle as these two cycles, right? Now, let us discuss about the ovarian cycle first. That is the follicular phase. So, if you take the menstrual cycle and divide the ovarian cycle separately and see, it will be like this, okay. So, the first half of the cycle is going to be follicular cycle or follicular phase, and at the mid cycle you will be having ovulation, that is the ova is released, okay. Then comes the luteal phase, right. So, this is how the cycle is going to be. Now, what happens during, this is going to repeat like a cycle, right. So, this will be continuing again as into a follicular phase, right. So, what will be happening is, when there is a luteal follicular transition, there will be a cohort of follicles that will be recruited, okay. So, a cohort of follicles recruited. So, the total number of days that is taken to reach the pre-ovulatory state is around 85 days, and recruitment and initial growth of the follicles is going to be follicular independent, gonadotropin independent, repeating once again. And if you see, the initial recruitment and growth of the cohort is going to be gonadotropin independent. Since the further growth of the follicle is going to take place under the effect of gonadotropins, now they will become gonadotropin dependent, okay. Usually, if you see the cycle, first menstruation has ended, one cycle has ended. So, at the end of this cycle, there is low estrogen, low progesterone as well as low inhibin. So, due to this, there is no negative effect on the gonadotropins. So, what is going to happen is follicle stimulating hormone start to increase, which stimulates the follicular growth as well. So, what happens? There is changes like increase in size of the oocyte, then transformation of the layer of granulosa cells, okay, like from single layer of granulosa cells to multi-layer of cuboidal cells. Also there is formation of the zona pellucida. Then there is stromal cell differentiation as well. Stromal cell differentiates into the theca cells. Okay. You have two layers again, that is theca interna and theca externa. Okay. So, when this is formed, it is known as pre-antral follicle. Clear? Right. So, this is how the follicles are going to grow. First, you have the oogonia, and when the follicles are formed, we have the pre-antral phase and the antral phase. Pre-antral phase is usually gonadotropin independent, okay, and antral phase is going to be gonadotropin dependent. Okay. You have the formation of primordial follicle, then primary follicle, secondary follicle followed by tertiary follicle, and finally we have the pre-ovulatory follicle or the Graafian follicle. Okay. So, this is the structure of a Graafian follicle, where you are able to see the granulosa cells. Okay. You have a basal lamina as well. Then you have the antrum. Antrum is nothing but the small vacuoles that have been formed, and it has formed into a big cavity. Okay. Then you have the corona radiata and cumulus ovaris. Corona radiata is the type of granulosa cells that is surrounding the oocyte, whereas cumulus ovaris is the granulosa cells that is attaching itself to the basal lamina, right. So, this is the structure of a Graafian follicle. Now, at this stage, we have to know about one theory, that is two-cell, two-gonadotropin theory. Okay. So, what does this theory means? We have two types of cells, right? We have granulosa cells and theca cells, and we have two gonadotropins. What are the two gonadotropins? It is follicle stimulating hormone and luteinizing hormone. So, how these two types of cells and these two types of gonadotropins are going to interact? That is all about two-cell, two-gonadotropin theory, right? So, we have cells, namely theca cells, and we have the granulosa cells as well. Then we have hormones, that is gonadotropins. On theca cells, luteinizing hormone is going to act, whereas on the granulosa cells, follicle stimulating hormone is going to act. Okay. So, when this is happening, what happens means, in the theca cells, there is conversion of the cholesterol into androgens, especially androstenedione. Okay. And this androstenedione is transported into granulosa cells, and finally it will be converted by the enzyme aromatase to estrogen. Okay. So, this is what is going to happen in two-cell, two-gonadotropin theory. Okay. And you have to note the fact that androgens are mainly produced in theca cells, whereas estrogens are produced only in the granular cells after they are transported from the granulosa cells. It will be converted from the androgens to estrogens by the enzyme aromatase. Clear? Yes. Now, what is the use of these hormones? Let us see what is the function of estrogen here. So, estrogen is going to cause proliferation of granulosa cells, Then it is also causes FSH receptor synthesis. Then estrogen production is also enhanced by the small amount of estrogen. Okay. Let's see about androgens. Androgens promote granulosa cell proliferation, they bring about the aromatase activity. That's how estrogens are produced, right? Then they inhibit the granulosa cell death as well. Clear? Right. Now let us see how only one follicle is selected to get ovulated. So we know in the menstrual cycle, during ovulation, only one ovum is being released. Mostly, rare times two ovum are released, which may result in twin pregnancy or a multiple pregnancy as well. But mostly, only one ovum is released. So which ovum has this chance of becoming a dominant follicle? So how it is selected? Okay. So what happens is there are follicle development which will be following which there is peripheral estrogen and inhibin B production which are going to increase. Then FSH level is going to fall because the hormones are more. So obviously they will be getting a negative feedback on the gonadotropins, follicle stimulating hormone. Then most of the recruited follicles will stop growing. Okay. Now what happens? There is one follicle called dominant follicle, that is the follicle with maximum number of FSH receptors, and they are going to produce more estrogen, and because of this increased production of estrogen, there is going to be further decrease in levels of FSH by negative feedback, right? Then what is going to happen? Other follicles except the dominant follicle undergo atresia. Okay? I hope you understood this, right? Yes. Now, we'll see what is this antral or tertiary follicle. So, there is further development of the dominant follicle. Further development of, so next we'll see about antral follicle or the pre-ovulatory follicle. So, antral or pre-ovulatory follicle is formed when there is further development of the dominant follicle. So, there is further development of dominant follicle. After that, there is going to be accumulation of fluid inside, that is nothing but the plasma. So, this plasma filled space is now called as antrum, and whenever this antrum is formed, from that stage the follicle will be called as antral follicle or tertiary follicle. Okay? And then follicle is going to increase in size rapidly, and it comes to a state of pre-ovulation when it is called as Graafian follicle. Clear? Now we will see the structure of Graafian follicle in detail. So, structure of Graafian follicle. It contains oocyte at an eccentric position and it is surrounded by zona pellucida. Granulosa cells are going to surround the. So, on one side, what we have seen, the oocyte is connected with the follicle. So, that is called as, yes, cumulus oophorus or discus proligerus. Okay. So, these are nothing but the specialized granulosa cells. Then, the granulosa cells immediately surrounding the oocyte are arranged in a radial fashion, that is called, yes, corona radiata. So, you have to know the fact that the granulosa cells, however, are going to be avascular and nutrition is obtained from the theca cells, which are the differentiated cells of the ovarian stroma. Clear? Then, what happens? There will be two layers of theca cells forming. We have the theca interna, which is nothing but the inner highly vascular layer, whereas the theca externa is there, which is the outer fibrous stromal cell layer. Clear? Yes. Now, we will see about the hormonal changes that is happening in the cycle. So, when we talk about the hormonal changes, when we have lower levels of estrogen, this is going to inhibit LH, that is luteinizing hormone, whereas higher estrogen levels are going to give a positive feedback for LH release. So, there is increased level of LH hormone. You have to also know that when estrogen hormone is sustained at a very high levels, okay, that is around some 200 picogram per milliliter for 48 hours, then what is going to happen is there is going to be a LH surge. Okay. So, what is going to this LH surge do? This is going to cause luteinization of granulosa cells, as well as there is production of progesterone as well. Okay. So, this causes further increase in luteinizing hormone, and there is also a small pre-ovulatory increase in the follicle stimulating hormone. So, follicle stimulating hormone is increasing, but not like luteinizing hormone, right? Okay. So, then what happens? From the theca cells, androgen secretion also occurs, and that increases the libido during ovulation as well. Clear? So, if you see this cycle, so you are able to see that we have two phases. Okay, just now concentrate on the hormone levels alone. So, we have, this is the menstrual period 1 to 5 days, then we have the proliferative phase, then we will have the secretory phase. This is in the uterine cycle, whereas in ovarian cycle we have the follicular phase and the luteinizing phase. Okay, and if you see the hormones, what is going to happen? The most of the follicular phase is going to be dominated by the estrogen. See the estrogen hormones, this is estrogen, right? So the estrogen hormones are going to be at a higher level. Okay, whereas the progesterone hormones are also going to work in the first half of the cycle, but even then that is going to take its place only after ovulation, like this. Clear? Then we have to especially see about the luteinizing hormone, which I am showing in pink color now. So luteinizing hormone is just like this, and it is going to peak in the ovulation. You have two things in luteinizing hormone elevation. So luteinizing hormone peak and the surge. Okay, I will talk about it later. Then we will have the follicle stimulating hormone as well. Okay, so this is the follicle stimulating hormone. See, there is a small increase in follicle stimulating hormone as well before ovulation. Okay, so these hormones can be marked separately. Okay, and it can be given as an MCQ. So you have to know which hormone is rising just before ovulation and after ovulation, which hormone is dominating first half of the cycle and which hormone is dominating the second half of the cycle. That's it, right? Okay. Now, we'll see about the ovulation phase as it is. So, when we speak about ovulation phase, there is local concentration of prostaglandins and proteolytic enzymes that are going to increase in the follicular wall. So, that will lead to formation of a small hole through which the secondary oocyte is going to extrude out, right? Then what happens? Ovulation is going to happen 10 to 12 hours after LH peak and 34 to 36 hours after LH surge. Clear? So, these two duration is very important in menstrual cycle. Okay. Next, you have to see about gonadotropins. They are regulated by steroid hormones, and if you see granulosa cells, the granulosa cells are producing two peptides and they are nothing but the inhibin and activin. So, from the name itself you can get that inhibin is going to inhibit the follicle stimulating hormone synthesis and release, whereas activin is going to activate the follicle stimulating hormone synthesis and release. Okay? And if you take inhibin again, you have two types of inhibin, namely inhibin B and inhibin A. Inhibin B is going to dominate the follicular phase and Inhibin A is going to dominate the luteal phase. Okay. Other paracrine regulators that are seen in the ovary may include the following factors like insulin like growth factor 1 and beta, then EGF, epidermal growth factor, then we have the insulin like growth factor alpha as well, then we can even have interleukin 1, then transforming growth factor, tumor necrosis factor beta also. Okay. So, these are some of the other paracrine factors that are produced by the ovary, right. Next is we have to see about the luteal phase. The follicular cells, that is the granulosa and theca cells, are now going to transform into corpus luteum. Okay. So, after the extrusion of the oocyte, the remaining of the cells are going to form corpus luteum. So, the granulosa cells will be taking up yellow colored lutein pigment. Okay. So, along with that it may also take the lipids as well. So, that is why it is yellow in color and that is why it is named as corpus luteum. Clear? Vascular endothelial growth factor helps in extensive vascularization for the granulosa cells to produce steroids. Okay. So, steroidogenesis is going to continue in these cells. Corpus luteum now produces hormones like estradiol, inhibin A, yes, correct, then progesterone, because after ovulation only corpus luteum is formed. So, we will have inhibin A, right. Then all these things are going to give negative feedback to the gonadotropins. So, there is decreased level of follicle stimulating hormone as well as decreased level of luteinizing hormone as well. Clear? So, after this, further development and recruitment of follicles does not occur because there is negative feedback. Okay. So, after this there is no cycle continuation and further recruitment of follicles also does not occur. Clear? Right. So, let us see the fate of corpus luteum now. When we see about the fate of corpus luteum, it can have two fates depending upon whether the pregnancy occurs or not. Okay. So, the main deciding factor is pregnancy. So, what if the pregnancy does not occur? So, pregnancy does not occur. So, corpus luteum is not going to get any support from the HCG which is produced by the syncytial trophoblast. So, for the corpus luteum to last and to produce hormones, it needs support and nutrition from the HCG. Okay. So, when there is no pregnancy, there is no syncytial trophoblast formation and there is no HCG, what happens? So, main deciding factor is there is no HCG. So, at that time corpus luteum regress after some 12 to 16 days itself. Okay. And it undergoes luteolysis and it will be forming, yes, it will be forming what? corpus albicans. Okay. So, corpus albicans, basically a white scar like tissue now. Okay. Corpus luteum is yellow in color and corpus albicans is going to be like a white scarred tissue. Okay. And then here, after the progesterone are not secreted, and since there is no support from progesterone, what is going to happen? There is shredding up of the endometrium. Clear? Yes. So, this is when there is no pregnancy. Now, let us consider when a pregnancy occurs. What happens? Okay. So, pregnancy occurs now. So, there is HCG support that is obtained from the syncytial trophoblast or the growing embryo. Then, it is going to secrete progesterone and that maintains the pregnancy. Clear? So, this is how the fate of corpus luteum is going to be there. Clear? Right. Now, we will see about the progesterone levels. Progesterone levels, when it is more than 3 nanogram per deciliter on day 21 of the cycle. Okay, so these two values are very important. I will repeat again. Progesterone levels when they are more than 3 nanogram per milliliter on day 21 of the menstrual cycle. Then that indicates ovulation. Okay. Suppose when the levels are more, like when they are more than above 10 to 15 nanogram per milliliter, then it will be in the follicular phase or luteal phase. It is going to be in the luteal phase, right? So, it is going to be in the luteal phase. Okay. Adequacy of progesterone is needed for pregnancy continuation, and if it is not adequate, then you have to give progesterone supplements. Clear? Right. Now, next we are going to discuss about the endometrial cycle. Endometrial cycle can be divided as, yes, proliferative phase, secretory phase, followed by the menstrual phase. So, during proliferative phase, only follicular phase of the ovarian cycle will be happening, and secretory phase corresponds to the luteal phase of the ovarian cycle, and menstrual phase is when the bleeding is going to happen. Clear? Right. Now, let us see in detail about the proliferative phase. Proliferative phase usually starts after the menstrual phase, that means just after the bleeding. There is glandular and stromal growth. To prepare the endometrium for implantation. Okay. So, after bleeding, what is going to happen? All the layers of the endometrium is going to get shedded, right? Now, what is going to happen is we have to again prepare the uterus for implantation. So, right after the bleeding stops, this building work will start again. Okay. And it happens due to the hormone estrogen that is produced from the developing follicles. Also know about the changes in the vessels in the uterus. So, the straight, narrow and small endometrial glands now are going to become long and tortuous. And then the lining of the endometrial gland is going to change from single columnar to pseudostratified epithelium with increasing mitotic activity as well. Okay. However, the stroma remains dense, but they can be infiltrated with cells which are derived from the bone marrow. Okay. So, this is a picture that is showing the uterus histopath in proliferative phase. You are basically going to have the growth of the glands as well as the stroma. Okay. And if you see this, this is the proliferative phase and this is the secretory phase. Okay. So, basically in proliferative phase, the arteries, if you see, they are going to become more tortuous. Clear? Right. Then we will see the secretory phase changes. Normally, in women, a cycle of 28 days is considered to be constant for study purpose. If 28 days of cycle is considered, then ovulation is considered to happen on day 14. Okay. So, day 14 ovulation is going to happen on in a 28 days cycle. Okay. In a cycle of 28 days. So, after ovulation, what is going to happen is there is effect of progesterone hormone. So, because of that, the glandular cells become filled with rich protein secretions now, right? Also, the glands become more tortuous and screw shaped. Spiral arterioles are also going to grow well and they become coiled as well. How about the stroma? Stroma also will be vascular and they become more edematous also. And 2 days after menstruation, there is infiltration by lymphocytes in the stroma by lymphocytes. Okay. Sorry, 2 days before menstruation. Okay. 2 days before menstruation, there is going to be infiltration. So, this will be indicating menstruation. Okay. Indicates the onset of menstruation. Clear? Right. So, in this picture you are able to see the secretory phase. So, all these small white color vacuoles what you see are nothing but the secretions that has been collected. Okay. And if you see this picture, you are able to see that the arteries are becoming more dilated and spiral. Okay. Right. Now, let us discuss about the last phase, menstrual phase or the bleeding phase. One important factor that is going to lead to menstruation is withdrawal of estrogen and progesterone hormone. Clear? And this leads to the shedding up of the functional layer of the endometrium, and this happens due to ischemic necrosis. The prostaglandins, namely prostaglandins F2 alpha, are produced, and because of the prostaglandins there is going to be a state of vasoconstriction as well. Myometrial contraction is there, that is going to remove or sloughs out the endometrium. There is also lysosomal breakdown and release of proteolytic enzymes as well, that will be promoting local tissue destruction, right? And finally, the entire functionalis layer is sloughed out. That means which layer will be left? Yes, the basalis layer is left, and from this regeneration of the endometrium is going to happen again. Clear? Regeneration of endometrium happens. So, if we see the thickness of endometrium during menstruation, it is going to be only around 0.5 millimeter, right? Whereas at the end of proliferative phase, that is around ovulation, the thickness will be around somewhere between 5 to 6 millimeter. Clear? Now, with the understanding of the endometrial cycle, I just want you to give a clinical application also, that is the endometrial dating. Endometrial dating is nothing but doing an endometrial biopsy just after ovulation. Okay, however, it is not going to be a reliable marker, but it was used and it is used less nowadays. Okay, so we'll be doing H&E staining, and now you have to compare the menstrual date, okay, according to the chronological date with that of the endometrial date. Okay, that is nothing but what you seen in the histology. Clear? And remember, a condition called luteal phase defect can be detected when the chronological dates and the histological date are more than 2 days ahead, okay, or having a difference of 2 days or greater than 2 days. Clear? So with this, we'll be completing this topic. Until we meet in the next topic, take care, happy learning, and bye-bye.